We are going to talk about the bones. The bones are an essential part of human skeleton. They give it support, protection, helps on the movement, are one of the places that we can store minerals, and they also have hematopoiesis function, producing blood cells from its red blood marrow. The bones can also help to determinate age and even age.
Now I am going to talk about the name of the bones, citing the anatomical and the common names. So we have the cranium, which is commonly called skull, the mandible, also called jawbone, the clavicle, scapula, sternum, ribs, femur, patella, tibia, and others, respectively collarbone, shoulderblade, breastbone, costa, side bone, kneecap, and shin bone. We also have the ilium, sacrum, pubis. But how do they like from the inside? Well, from the outside to inside, we can see periosteum, spongy bone, compacted bone, blood vessels, yellow blood marrow, and red blood marrow. Some of them also have cartilages on its outside that helps them communicate and articulate with other bones.
Unfortunately, nothing is perfect and bones break. They fracture. With that said, we can also say that there are several types of fractures. For example, simple, compound, green stick, comminuted, impacted, linear, transverse, spiral, and others. We can see them better with x-rays, but clinically speaking, what would a patient feel in case of a broken bone? Swelling, deformities, pain, loss of function, inability to bear weight on the affected member, and even bone protruding from the skin. It is also valid to remember that bones can fracture from many causes, but the main are fall, blow, and traumatic events.
Fortunately, fractures can be repaired, and our own body does that for us. Cells called osteoclasts constantly break down old bone so that osteoblasts can replace it with new bone tissue, a process called bone remodeling. Bone remodeling is a continuing process of synthesis and destruction that gives bone its mature structure and maintains normal calcium levels in the body. Destruction or reabsorption of bone by large cells called osteoclasts releases calcium into the bloodstream to meet the body's metabolic needs and simultaneously allows the bone, which is inhibited by its inorganic component from growing by cell division like other tissues, to alter size and shape as it grows to adult proportions or remodel. While the osteoclasts reabsorb bones at various sites, other cells called osteoblasts make new bone to maintain the skeletal structure. Usually, bones need a little help to remodel. We can aid them by using traction splint, plaster boots, or simple plasters. Depending on the type of fracture, doctors insert plates, intramedullary rods, and pins. They do this surgically. Patients also use wheelchairs and crutches in order to get better.